You may not have heard of this painful skin disease, but it's actually pretty common. Imagine going through life with painful, sometimes smelly, golf ball-sized boils in your armpits or groin. For people with hidradenitis suppurativa, HS, that's a reality, says Iltfat Hamzavi, MD, an American Academy of Dermatology fellow and a senior staff physician at Henry Ford Hospital in Detroit. The disease isn't super rare either. HS affects between 1 and 4 people out of 100, says Hamzavi. Think you might have it? Here's what you need to know about HS and managing the condition. What exactly is hidradenitis suppurativa? In short, HS is a common but rarely diagnosed chronic, and relapsing, disease of the hair follicle, says Hamzavi. It's not contagious and is characterized by swollen, painful bumps that typically drain pus, says Andrew Alexis, MD, chairman of dermatology at Mount Sinai St. Luke's and Mount Sinai West in New York City. HS is also more common in women than men. The boils associated with the disease usually pop up in the same places: your armpits, groin, buttocks, around your breasts, or your inner thighs, says Alexis. Here's what it looks like. Why is it so hard to spot? There's a serious lack of awareness about HS, says Hamzavi. So the boils associated with the disease can sometimes be mistaken for bacterial infections or sexually transmitted diseases. Yet HS is neither. It's not caused by poor hygiene, it's not a sexually transmitted disease, and it's not the result of a bacterial infection. HS is usually aided by the fact that the boils show up in characteristic locations, says Alexis. The problem? Diagnosis is just the beginning of the pain, both physical and emotional, linked to the condition. HS is notably the worst quality of life impacting disease in dermatology, says Hamzavi. What are the side effects? Not only can HS bumps be painful to the touch, but the drainage can stain your clothes and smell, which can be embarrassing, says Alexis. Many people with HS carry an extra set of clothes for that reason. Simple decisions that many take for granted, such as choosing a bathing suit or a sleeveless shirt, are very complicated for those with HS, says Hamzavi. Sufferers may isolate themselves from friends, family, and even sexual partners. The far-reaching physical and emotional impacts of HS often result in depression, creating another facet of difficulty in daily life, says Hamzavi. Plus, scarring, seen in more severe cases, can impact physical activity, forcing you to limit the sweat sessions you may love. You also can't plan for a flare-up. HS is largely unpredictable, says Hamzavi. However, sometimes stress, sickness, or a poor diet can trigger a flare, he says. Ladies also tend to report that HS worsens around their periods. How can you cope? If you have HS, your best bet is to find a dermatologist who's experienced in treating it, says Hamzavi. Consult the Hidradenitis Suppurativa Foundation's directory to find one. You'll also want to track flares and report things like fever, severe swelling, uncontrolled pain, rapidly spreading redness, or discomfort to your doc ASAP, he says. The good news? There are potentially effective treatments for the condition: antibiotics, retinoids, steroid injections, surgery, and other medications, says Alexis. There are also at-home remedies you can try. Do a health check. It's important to maintain a healthy weight and, if you're a smoker, to drop the cigs if you're suffering from HS. The disease is more common in those with a higher BMI and among smokers, says Hamzavi. Give yourself some TLC. Applying warm compresses to the boils can help reduce both swelling and pain, says Alexis. Make sure you're cleaning affected areas daily with an antibacterial soap or cleanser, too, he says. And aim for a happy medium when it comes to moisture on the skin. Do not allow the areas of affected skin to become too dry or to become too wet, says Hamzavi. Dress the part. Wearing loose clothing can help curb any pain from rubbing or too tight clothes, says Alexis. Many HS sufferers also use maxi pads or panty liners to absorb drainage, says Hamzavi. Seek support. Since HS can be linked with depression, family, friends, and a good medical team are all key in managing the disease, says Hamzavi. There are many online support groups and some face-to-face groups around the country, too. If you feel your pain is going beyond just the physical, consider talking with a mental health professional to learn to cope with the emotional impact of this disease, says Hamzavi.